Hi, I'm Alicia. I'm going to be your nurse practitioner today. This is going to be a video on the cardiovascular and peripheral vascular um, systems. I just want to make sure that I have your consent to video you for my instructor.
Yes.
Okay. So to start off the cardiovascular assessment, we would start off with making sure that we had blood pressures both supine and upright in both arms, and then we would compare those for any abnormalities, and we'd want to kind of take an average of the two. Then we're going to go next to looking at the jugular vein and inspection. So optimally, we would have our patient in a supine or in a 30 degree to 45 degree angle, and we're looking at have you kind of just rest back a little bit. We're looking for any pulsations here in the jugular. What we do then is, if we see that point, the highest point, get straight edge from here and then measure. With her, I'm not seeing anything, and it may be because she's not lying down, but we would measure from that maximum point there and see that. We want something below 3 to 4 centimeters before we would see any abnormalities there. So that's how we would measure that. Next, we're going to do just inspection of the carotids. We want to be looking for any pulsations that we can see. Then we can also palpate, and we want to palpate one side at a time. We're feeling for any bruits or thrills, and then we want to auscultate. First with our diaphragm. Comparing both sides. And then again with our bell. Next, we're moving down to our chest. First, we're going to be inspecting. Obviously, in a patient in a clinical setting, we would have them without their shirt on, so we can do a good inspection. We want to be looking at the chest, checking for any obvious abnormalities within their chest. We're looking for any pulsations that we can see. And then we would move on to palpation. Just palpating for the point of maximum impulse. Another good way to do this is to have the patient lay down on their left side and feeling up underneath on the side for those heart tones as the heart moves closer to the chest wall. When you're palpating for any thrills, any lifts, any heaves. We're moving into the auscultation portion. We're going to auscultate in all of the areas of the apical or the aortic valve, which is in the second intercostal space. Moving over onto the left sternal border for the pulmonic valve. Moving down to the third for Erb's point. The fifth intercostal space is the tricuspid valve. And then moving under to the mitral valve, which is in the mid-clavicular line. All of these we're also going to auscultate with the bell. We're listening for the normal S1, S2. We're also listening for any extra clicks, murmurs, taking a deep breath in. Pause and listen to see if you can hear a splitting of the S2, which can happen on inspiration as the pulmonic valve is closing. So we've auscultated in all of these areas. I just hear a normal S1, S2 in this person. Obviously where we're listening is, we're listening for any type of murmurs or different sounds that we can hear. And it depends on where we're listening to those as to what that might point us as to where the defect is. Next, we're moving on to a peripheral inspection. And once again, we're just inspecting. We're looking for good color. We don't want to see any cyanosis in any of the extremities. And then we're moving on to checking for capillary refill. We want that to be less than 3 seconds in all of our fingers. We're looking for any clubbing, any staining or tarring of the fingers. Doing this bilaterally. Then we're going to be checking pulses. Start with a radial. And you're wanting to compare these, make sure that they've got a good, strong 3 pulse, which would be normal. We'll move on to the brachial. And then we can move on to the femoral. Obviously we want the patient to be lying down, and we can feel in their femoral pulse. Do that bilaterally. And then we're moving into the popliteal. Just relax your leg. Move down to the tibial and the pedal pulse. We also want to inspect their nails on their toes, making sure that they don't have any cyanosis. We're looking for any color changes on the skin in the lower extremities. We're looking for any edema. And we're also looking or feeling for good warmth. We don't want to have any coolness in the extremities. And we would be doing that also bilaterally. We can also do an aortic. While the patient's laying down, we can look for the aortic pulsation of the aorta. We also want to auscultate this with both our diaphragm and our bell. And we can do some palpation as well. If you can feel that. On some patients, you're not going to be able to feel it. Obviously, very cachectic patients or very thin patients, you're going to feel that pulse pretty easily, and you're also maybe going to be able to visualize that when they're laying flat. This completes the cardiac video. Thank you. Oops.